Exhale slowly, all the way to the end. The thing you just did, that wasn't muscle contraction. Your diaphragm went limp, and in the 4 seconds it took to let go, your heart slowed, your blood pressure dipped, and a nerve most people can't name quietly told your body the threat had passed. The diaphragm isn't a muscle most people could draw. It's a sheet, thin, dome-shaped, sitting under your lungs like an upside-down salad bowl pressed against your ribs. When you breathe in, that dome drops about a centimeter. That's the entire trick. 1 centimeter of movement, repeated more than 20,000 times a day, is what's keeping you alive right now. Hold that number, 20,000, because in a minute it's going to collide with something your cardiologist would find more interesting than the breath itself. Here's where the standard explanation falls apart. When you breathe out, the dome doesn't push the air back up. It just gives up. The lungs spring back on their own. Like a balloon, you stop pinching closed, and the diaphragm rides the recoil. It's the only major muscle in your body whose most important job at rest is to know when to stop working. Which sounds like a small thing. It isn't. The letting go is doing something, and the something it's doing isn't in your lungs at all. I'll be honest, when I first really understood this, I had to sit with it for a minute. We're told to engage the diaphragm, to use it, to strengthen it. None of that is wrong, exactly, but it misses the architecture. The diaphragm isn't a pump you crank. It's a muscle that contracts on the way in and surrenders on the way out. And the surrender is doing something invisible that almost nobody explains. And what it's doing is talking to your heart. The phrenic nerve runs from your neck, specifically the 3rd, 4th, and 5th cervical vertebrae, down through the chest to the diaphragm. It's the sole motor nerve for that muscle. Every breath you've ever taken has started with a signal from that nerve. But the diaphragm doesn't sit in isolation. It sits directly above the vagus nerve, the longest nerve in your autonomic nervous system, the one that wanders from the brainstem down through the neck, chest, and gut, regulating heart rate, digestion, immune signaling, the whole quiet infrastructure of being alive. When the diaphragm contracts, it presses and stretches structures around it. When it releases, that mechanical pressure shifts. And the vagus nerve, which is exquisitely sensitive to those changes, fires accordingly. This is where it stops being anatomy and starts being something stranger. Put your fingers on your wrist and breathe in slowly, then breathe out slowly. If you can feel your pulse precisely enough, your heart rate goes up on the inhale and drops on the exhale. Every single breath. This is called respiratory sinus arrhythmia. The phrase sounds like a disease, which is unfortunate because it's the opposite. It's a sign your nervous system is working exactly as it should. The variation in the gap between heartbeats can exceed 120 milliseconds across a single breath in a healthy young adult. Your heart is, in a quiet way, dancing with your lungs, and has been every breath since before you were born. Quick one while we're here. Did you actually feel that, the slowing on the exhale? Yes or no in the comments. I'm curious how many people have noticed it without knowing what to look for. The mechanism behind that slowing is the vagus nerve releasing acetylcholine onto the sinoatrial node, the cluster of cells in your right atrium that sets the pace of your heartbeat. Acetylcholine slows the firing rate. On the inhale, vagal tone drops and the heart speeds up to push more blood through lungs now full of fresh air. On the exhale, vagal tone surges back and the heart slows because there's nothing urgent to push through. It's an efficiency mechanism. Heartbeats are metabolically expensive, and the body doesn't want to spend them when they're not earning anything, which raises something I almost never see mentioned in breathing content. The magnitude of that heart rate dip on the exhale isn't a fixed thing. It's a measurement. It's one of the most reliable markers we have of autonomic nervous system health. Athletes tend to have bigger swings. People under chronic stress tend to have smaller ones. And that number, how much your heart slows on the exhale, independently predicts cardiovascular outcomes years out, across populations, even after adjusting for the usual risk factors. Which means the thing your diaphragm does when it lets go isn't just a curiosity. It's a vital sign you can't see on a blood test. Now, and this is where the title of this piece becomes slightly mischievous, the question of whether you use the diaphragm properly on the exhale is genuinely the wrong question. You don't use it, you release it. The skill, if there is one, isn't muscular. It's about how long you allow the release to last. Here's the part that took the research a while to settle. When you slow your breathing down to roughly 6 breaths per minute, about half the typical resting rate, and you let the exhale be longer than the inhale, something specific happens to the baroreflex. The baroreflex is a feedback loop between pressure sensors in the walls of your aorta and carotid arteries, and the brainstem centers that control heart rate. At around 6 breaths a minute, the rhythm of your breathing starts to resonate with the natural oscillation frequency of that loop. Vagal output increases, heart rate variability rises. The entire parasympathetic side of your nervous system gets louder. In other words, a slow exhale isn't relaxing because slow things are relaxing. It's relaxing because the physical act of extending the exhale recruits a reflex arc that was already there, built in, waiting. You're not creating calm. You're unlocking a circuit that already existed. That distinction matters, because one of those can be sold in a bottle and one of them can't. Now here's a thing the textbook won't tell you, and physiologists will quietly admit if you corner them. Nobody fully knows why this mechanism exists in the first place. We've measured respiratory sinus arrhythmia since 1847. We can track it in milliseconds. We use it to predict cardiac outcomes. And we still can't agree on what evolution was actually solving for when it built it. The leading theory is that it's a gas exchange optimizer. The heart beats faster when the lungs are full of oxygen, slower when they're empty, so each beat moves the freshest blood available. The competing theory is that it's a cardiac efficiency mechanism, fewer beats for the same oxygen delivery. Both might be right, both might be incomplete, which is honestly the part I find most interesting. A reflex this precise, this universal, this clinically predictive, and we're still arguing about its job description. Hold that thought, because the number that comes next is the one that should have been on your last physical and almost certainly wasn't. A meta-analysis pooling 32 studies and more than 38,000 participants found that lower heart rate variability independently predicted higher all-cause mortality across different ages, sexes, continents, and populations, with an effect size comparable to that of uncontrolled hypertension. Not correlated, predicted, independently after adjustment for the standard risk factors. A measurement of the gap between your heartbeats, requiring no equipment more sophisticated than a finger on a wrist, carrying that weight. I find that strange every time I think about it, and the number tends to decline with age. Gradually, measurably, not uniformly, there's enormous individual variation, and fitness, sleep, and chronic stress all shape the trajectory. But the general direction is downward, starting somewhere in the second or third decade of life, which means the question of whether your exhale is doing its full the job is one that gets more, not less, relevant as you get older. Now I want to steelman the skeptic for a moment, because the wellness industry has thoroughly ruined the word breathwork, and any honest science communicator should acknowledge that. Most of what gets sold as breathing technique is dressed up common sense at best and pseudoscience at worst. The claims that slow breathing detoxifies your blood, oxygenates your cells, or rewires your brain in a week are not what the literature says. What the literature does say, replicated across multiple controlled studies measuring vagal activity directly, is narrower and more honest. Slow-paced breathing at around 6 cycles per minute, with the exhale longer than the inhale, produces a measurable, immediate, repeatable increase in cardiac vagal activity. The effect returns to baseline once you stop. Whether long-term practice produces lasting changes to resting HRV is a genuine open question, with preliminary evidence pointing toward yes, but the dose and population specifics aren't settled. I spent the better part of a fortnight once reading nothing but papers on heart rate variability, partly because the gap between what the research actually showed and what was being sold off the back of it had become genuinely irritating. The strange thing wasn't that the biology turned out to be modest. The strange thing was that it turned out to be cleaner than the marketing. A simple, measurable, mechanically grounded reflex that almost nobody was describing accurately, because the accurate description doesn't require a supplement. I want to be precise here, because precision is exactly what the wellness version skips. The effect of a single session of slow breathing on vagal activity is acute, real, measurable, and it drops back to baseline when the session ends. What builds over time, and the evidence here is preliminary, not settled, is a kind of trained responsiveness. The circuit gets used. Whether using the circuit translates into a structurally higher resting HRV across months and years is where the research is still catching up. The mechanism is solid. The long-game dose is the open question. And I'd rather you knew that than walk away with a cleaner story than the science supports. Back to that number. 20,000 contractions a day, more than 20,000 releases. The diaphragm is the only major skeletal muscle in the body running this cycle continuously, without rest, from before birth until the moment it stops. And on every single one of those cycles, the part where it lets go is the part where your heart catches a breath of its own. That image of the heart and the diaphragm in a continuous millisecond level negotiation about how fast to run is not a metaphor. It is the mechanism. It is happening in you right now as you watch this. The reason this matters in the time frame of your actual life is that the release window is something you have some influence over, and almost no one uses it. When you're under sustained stress, the low-grade chronic kind, the kind that doesn't feel like stress anymore, it just feels like being alive, your exhale shortens, not deliberately. The sympathetic nervous system biases breathing toward rapid, shallow, upper chest patterns. The diaphragm barely descends. The release is cut off before it completes. And the vagal pulse that would normally slow your heart on the exhale becomes a whisper instead of a sentence. The heart, receiving no instruction to slow down, keeps running at whatever rate the stress set. Over one day, this is small. Over months and years of that pattern locked in place, it's the difference between an autonomic nervous system that can shift gears and one that can't. So if there's a how, it isn't a technique, it's a noticing. The diaphragm doesn't read the clock. It reads the ratio, how long you spent pulling air in against how long you allowed it to leave. When the leaving is longer than the pulling, vagal output rises. That's the entire instruction the mechanism is offering. Not breathe deeply, not breathe through your nose. Just, when you exhale, let it finish. Tonight, before you sleep, try one thing. Inhale for a count of 4, exhale for a count of 6. 10 repetitions. Don't make it a project. Don't make it a routine. Don't make it a practice. Just notice what your heart does during the 6th count of each exhale. If you can feel it slow, that's the muscle in your chest, the one that contracts every time you breathe in, doing the work it was built for on the way out, which is, accurately and finally, nothing at all. Tell me in the comments, did the slow exhale feel different from a normal one, or did the difference only show up in your chest? The responses that push back on the mechanism are the ones that keep this honest, and the science here is more contested than the wellness version admits. That's exactly where the real picture gets sharper.